Welcome to the show.
Thank you for having me.
You have some unique perspective here. You've gone to see Irv as a patient, and you were referred to see a hypnotist.
Yes, I was. Yeah.
What was the conversation like between you two when that subject came up?
Well, I have to admit, it has come up. It had come up previously in other visits.
For years.
Yes, that I was. I didn't so much not want to or disagree. I think that I was just so sick and still looking for other, quicker fixes and things that just, you almost just want the pain to go away. You want the symptoms to go away so badly that you don't, want to think about, do I have to put effort into trying to make it go away. You just want it to go away. So initially I was hesitant about acting on it, but then you get to a point in your life where you're just so sick and you've done everything and you've tried everything, and you realize that you do need to make that effort, and when you do, it's a pretty amazing experience.
What insight can you offer about her situation and what you saw and how it progressed? And
well, IBS, like any disease, has a range from mild to very severe. Donna is, unhappily, at the very severe, very, very severe end of the range. I don't hospitalize most of my patients. When it's bad enough that people can't eat, literally can't function at all, that's bad. Those are the patients who become open to hypnosis. In this day and age, still not in the popular psyche as an obvious early intervention. It's more, this is going to be my last resort, doc, before I die. Maybe I'll break down and see a hypnotist. Not entirely logical. I think many more people than the very ill could benefit, but one way of looking at it is any therapy that works in the worst cases is a darn good therapy.
Yeah. So were you searching for answers before you met Irv? Had you been to other doctors? And
I hadn't been to the right doctors, I think.
Yeah.
I think that once I found the right doctor and and started to understand what was really going on with my body, and and it is not uncommon that that sometimes we do see the wrong doctors, and that they're looking at the all different reasons for our symptoms. But when you finally find the right doctor and finally start figuring out what's going on with you and it starts making sense, then you can start working on how to deal with it, how to treat it, how to manage it.
So what makes him the right doctor?
Because I think that sometimes the symptoms can be misunderstood, and I think quite often, being a female and it being just in the abdomen, that they often think of maybe gynecological symptoms for it. They don't seem to think automatically or initially gastrointestinal disease, because some of the symptoms do cross over and can be symptoms of other illnesses. So I think that a lot of that for me was that they were misdiagnosing my symptoms. And so when I finally ended up meeting him actually as an inpatient on a consult, he happened to be the doctor on call when I was admitted to the hospital, and he started treating me. Then things changed for me as far as my diagnosis. Yes.
And then you guys were working together for 5 years.
We worked very closely. I have spent a lot of time with him, but he saved my life.
Is that right?
Absolutely. Yeah. I have no doubt in my mind. It's like when he brought up the analogy of asthma and how patients die of asthma. I was very, very, very sick with IBS. I think I never imagined that I could be as sick as I was, and I am just so glad now that I am not that sick anymore, and that I'm able to have a more symptom less free or life that I can function.
Yeah. Irv, what's the relationship? Is it a special relationship between you and the IBS patients? Is it more of a special relationship than the other patients you see?
Yes, certainly.
Yeah.
You spend so much more time together. The stakes are pretty high.
Yeah.
Very often, patients have, not gotten the, how should I put it, the care they hope for elsewhere, and so they feel that you're a last resort. But basically, it's just a real tough situation they're in, and they're requiring a great deal of care. So, gosh, you're just together.
Yeah.
Long hospital stays, frequent office visits, and dramatic things happen.
So you're going to be moving forward in a wonderfully productive and healthy way?
Yes, I am. I already have.
Is that right?
Well, he said we don't talk as much
know.
anymore.
We'll have to start to get together socially. Maybe you can bump into each other down at Dunkin' Donuts or something.
Can't really drink coffee, but
That's true. Green tea, maybe.
Green tea.
Yeah. Yeah.